Hi, I'm going to do my presentation on CPR. CPR stands for Cardiopulmonary Resuscitation. CPR is an emergency procedure used to manually preserve and maintain brain function in a person who is suffering from cardiac arrest. CPR is used until further measures to restore spontaneous blood circulation and breathing can be performed. In other words, CPR is used to revive or bring back a person to life. How do you perform CPR? If you should ever find someone who appears unconscious, perform the following 6 steps to see if CPR is needed. Survey the scene for any danger that might harm you or the victim. For example, a fire, toxic gases, or any unknown liquids around the victim. Check for consciousness by tapping or shaking the victim. If there is no sign of consciousness, have someone call 911. Check for breathing by raising the victim's chin up away from the chest to open an airway. Put your ear over the victim's mouth to feel for breath. Watch the chest for any signs of breathing for at least 10 seconds. If the chest is not rising or falling, the victim may be choking. Check their airway and remove any blockage before starting CPR. After the airway is clear, check for a pulse. Place 2 fingers on the side of the victim's neck for the carotid pulse. If no pulse is present, begin CPR. There is no need to take off any of the victim's clothing in order to perform CPR. This is how you perform CPR. First, do 2 rescue breaths by pinching the victim's nose together and blowing 2 1-second puffs of air into the victim's mouth. Wait a few seconds between breaths and ensure the chest rises and falls with each breath. After the second breath, start the chest compressions. Place the heel of your dominant hand 2 inches above the base of the sternum. Interlock the other fingers of your other hand on top of the dominant hand. Make sure your arms are perpendicular to the victim's body. Push down 2 inches, ensuring only the heel of your dominant hand touches the victim. Let the chest rise up before pushing down again. Push down 30 times at the rate of 100 compressions per minute. 30 compressions should take about 20 seconds. After 30 chest compressions, give 2 more rescue breaths. Continue this process for about 2 minutes, then check for signs of breathing. If there are still no signs of breathing or consciousness, continue CPR till medical help arrives. These directions are for 1 person's CPR. If a second person can help, one can do rescue breaths and the other can do chest compressions. In this case, do 1 rescue breath and 15 chest compressions and repeat. CPR takes a whole lot of work, so switch places every couple of minutes after a rescue breath. Also, be careful doing CPR on a child under 1. Rescue breaths need to be a lot smaller, and the chest compressions should be done with the pointer and middle fingers instead of the heel of your hand. I hope you have learned something from my presentation. Who knows, it may help you save a life someday.